States is the only one that the drug makers are setting their own costs. So if you're in Australia, the government is negotiating the price of drugs. They set a price, that's it. In the United States, there isn't a government regulatory to negotiate any pricing on prescription pills. What happens is the drug company sets the price, then they negotiate between insurance companies. That's crazy. So different insurance companies are going to have a different set point of the price of specific prescription pills.
Right. You're not even picking the drugs you want to take or the brands. No one ever presents you like, hey, these are 4 blood thinners. This is the price for each of them. Which one do you like? Here are this is the cost analysis. These are the pros. These are the cons. You can choose. No one says that. Is your doctor gonna give you whatever the insurance negotiated with the company? If insurance company gets a better deal with Xarelto, you're gonna be on Xarelto versus Coumadin. That's just how it works. It's crazy. You don't see any of this.
And you don't know whether that pill is more effective or not. It's just what your insurance has negotiated. That's a treatment that you're
right.
using.
What it covers.
What it covers. So that's one corrupt system we have to fix. We have to make sure our healthcare system is more regulated by the United States government, where the United States government is freaking talking to these pharmaceutical companies or negotiating prices, just like in other countries like United Kingdom, Switzerland, Australia. Not freaking free reign in America, and they could do whatever they want.
Right.
And unfortunately, we have lobbyists, which these pharmaceutical companies are paying millions, billions of dollars to sway things their way, to make sure things are the way they are here, because they're freaking making tons of money.
Yeah. Think about lobbyists are very strong. Like, there's a reason why cigarettes still exist. It's just lobbyists. That's the reason why cigarettes have been shown to be healthier or produce no harm in the past. Just lobbyists, just because they were able to sway people that are in Congress or in the Senate or House of Representatives. They were able to sway their opinion.
They did it for decades.
Yeah.
Before we finally said, hey, we need some freaking labels, man.
Yeah, that's how it works.
And let's go into the next topic, which is how much does the hospital pay for these prescription pills? And that's interesting because not only are these pharmaceutical companies making money off us, there's also the hospital that has to make some kind of profit, right? So how does that work? There was a study performed by the Moran Company, commissioned by the Pharmaceutical Research and Manufacturing of America, and they compared 20 different brand drugs, compared costs, and just to kind of see what is the price. So the markup on drugs was nearly 487%, this study showed. So the hospital gets the drug for this much, they mark it up 487%, and then everything is left to negotiation with the insurances. I don't want to get into the statistics of what they use, but they used cost per unit data, they used hospital charge per claim, and they did all the statistics, and the results were that the markup was up to 2.5 times more than what the drug actually costs. So not only is the pharmaceutical company making some money, the hospital's profiting on average, based on the study, 2.5 times.
Yeah, that's insane. Like, all these negotiations are done with any of your personal input. These prices are set for you, and this is what you got to pay. No negotiation. This is just how it works. And it's crazy. You can't choose what kind of medication you want. You have literally no room for any kind of opinion. You can't say you want to go on this floor or do you want to go on this hospital. You don't see how much anything's going to cost you. You just get one lump sum bundle once you leave the hospital.
And especially like you're an uneducated person, like, we're nurses in the healthcare system. You don't know what pill could be better. What, like we described, Coumadin is like $15 compared to Xarelto. They're both blood thinners, but that one is like $400 a pill. Yeah. You don't know that maybe Coumadin is a little bit better because it's safer. You could reverse the drug compared to Xarelto. If you get a brain bleed, you're just bleeding out till the drug, leaves the system. Yeah. And we don't know that, but the doctor just says, "Hey, take this." We trust the doctor, and we just do it.
Right. This is what we negotiated, the hospital and the pharmaceutical company, and then this is what your insurance covers. This is what you got to take. It's you take this, or you pay fully out of pocket for someone that you want. And there's no room for opinion. And then a lot of these doctors, it's all marketing ploy sometimes as well. So these pharmaceutical companies will dump large sums of money into marketing just so they could prove their point or get their point across without much like factual information. Like, I was on Reddit one day, and it was a Reddit post that like, what surprised you the most when you first came to the United States? And a lot of them said that there's pharmaceutical ads, on TV.
In the United States.
And that's crazy because they don't have them anywhere else in the world. They have them here because they could pay for the marketing, and that marketing brings them profit because they could sway your opinion. And that's crazy to think about.
We have, we're the only country that has ads on pills.
Yeah.
And we become very dependent. If you look at patients sometimes, dude, they will not go to sleep unless they get their little sleeping pill, not melatonin, what's the other one? Ambien. They will not fall asleep, man. They've became so used to it that they need it. And literally, if you look at the big picture, we're a pill popping freaking country, man.
Right. And it's crazy to think about something like insulin, where there was a big issue about it being upcharged and just sold for a lot of times a vast amount of profit, where people have succumbed to that state where they're willing to put profits over human lives. Like you said before, people are rationing insulin because they don't have enough. They save it because they can either give 4 units today and not know what's going to happen tomorrow, or they can give 2 today, have a little bit of coverage, and then 2 tomorrow to have a little bit of coverage, which is crazy.
Not knowing the repercussions because they're not doctors.
Yeah. That's the way healthcare works here.
And to summarize things, there isn't a perfect solution for this, but we have to basically admit the problem that healthcare is a business. There's a lot of issues in America that is basically pointing to that our healthcare system is not the best. Right. We have to start taking healthcare more seriously. We have to pass legislations that are going to allow for better healthcare coverage for everybody, right? And we have to start tackling these pharmaceutical companies, which have deep pockets in our politicians that are not allowing a government to regulate the prices, and they create their own prices.
Yeah, we've had a private healthcare system and a pharmaceutical company for centuries now. Clearly, it's
centuries
not working.
Is a lot of hundreds of years, bro.
Decades. Decades. Damn. Well, maybe it's been centuries. I don't know how long it's been.
Probably not, but go ahead.
We'll go with decades. So we've had private healthcare multiplayer system for decades now, and it clearly is not working. Prices are inflated. People are getting charged a vast amount of money, and they can't afford it. Why keep trying to fix a broken system when you could maybe try a different alternative, and maybe that'll work a lot better? It's working for a certain country, but why can't it work for us? We're the United States. We could figure it out. We can't figure out this system because it's just such a for-profit system.
Yeah.
But I believe a one-player system would probably benefit the majority of the United States.
And that's going to be a whole approach. We have to make sure our politicians are not getting paid by these pharmaceutical companies that are keeping these players in play, man. And we need some ratification, man. We need a reform. We just like with for example, gay rights, man. It wasn't popularized back in the day. People marched on the streets, protested, and things happened, man. And maybe we just have to get together and protest.
Yeah. Well, we'll see what happens. Election coming up next year, so we'll see how it goes.
Whoever listened this long, guys, drop a comment. You guys are troopers. You guys probably learned a lot about the healthcare system. You guys basically...
sweating over here.
So yeah, you guys could probably just tell your friends and just expose the system of what's going on. It sucks. It's a real deal, and we hope that you guys learned something. Stay tuned next week. Like I said, subscribe and keep on hanging out with us. See you guys next week.
Have a good one, guys.